Right now, you're receiving some information, and we are passing around a sign-in sheet. The reason for this is just because we are federally funded, so when we do events like this, they do ask that our participants sign in. We will not do anything with your information, so you're safe with us. So, we're going to talk a little bit today about, I'm going to be speaking a little bit about Medicaid waivers and state and federally funded assistance available through our agency. So a little bit about our agency. We are a nonprofit 501c3. The Area Agency on Aging was established in 1973 through the Older Americans Act. Anywhere in the United States that you go, there will be an Area Agency on Aging that services their elderly and disabled population. Sometimes they go by different names, but if you Google Area Agency on Aging, Milwaukee, whatever that designated agency is will come up. Although we are nationwide, each agency is its own independent entity. So Area Agency on Aging for Southwest Florida is one of 11 in Florida, but we're our own organization. We service 7 counties, Lee, Collier, Charlotte, Hendry, Glades, DeSoto, and Sarasota. So, our mission is to connect adults with disabilities and senior citizens to resources and assistance so that we can live independently and safely in the community. The services we offer at our Area Agency on Aging, we have the Elder Helpline. I'll go a little bit more into that in a slide or two. The Aging and Disability Resource Center. This is also going to be a part of just about every Area Agency on Aging in the United States. We offer health and wellness classes, Shine Medicare counseling, and elder abuse prevention and education. All of our services are offered no charge. There will never be a charge for anything we do for you, as we are a nonprofit. So the Elder Helpline is pretty much the gateway to any of the services that you can obtain through our agency. So this is our phone number. The Elder Helpline is an information and referral organization first and foremost. So what they do is they connect callers who have some sort of a need with resources in the community that can help them with that need. Our resource database is unbelievably large. So if you have a need or you know someone that has a need, there's a very good chance we can connect them with someone who can help. We have a very small but mighty team who work very hard to answer calls. Sometimes you'll have to leave a voicemail, but we will get back to you. So the Aging and Disability Resource Center is another part of the organization. And what we do there is we screen people to be placed on what's called the state priority wait list. And this wait list is to receive state or federally funded assistance, again, for our seniors or disabled adults to live safely in their home. The goal here is to avoid nursing home placement. So we want our people to be in the least restrictive and most comfortable environment safely as long as possible. We also provide assistance in applying for that Medicaid waiver should this person be selected by the Department of Elder Affairs. And we provide education so that because you don't know what you don't know, and when you're going into this process, it can be overwhelming, and we're here to walk you through that. A little bit about the assessment should you have a family member who wants to apply or you think is a good idea. It's about 45 minutes, although sometimes, people want to talk a little longer, so we say 45 minutes to an hour. We ask about health conditions. We go into what's called activities of daily living. Basically, how much help do you need with showering? How much help do you need with dressing? Things like that. And then we ask how much assistance you actually have, because sometimes what we need and what we have are not the same thing, right? So that after that 45 minutes, we're given what's called a rank. And our state priority waiting list is maintained by level of rank. And your rank is based on your level of frailty. So in the state of Florida, there's a lot of need, not as many resources as there is need. So the people with the highest level of frailty are going to be the ones that get those services first. And the reason I say this is that we'll sometimes get calls from people, I've been on the wait list for 5 years, but they can do their own shopping, they can drive themselves all over town, they don't need any help taking a shower. They're not going to get the assistance as quickly as someone who can't take a shower by themselves, who can't go to the store, who can't even verbalize a shopping list. So that's how the ranking system works, and that's why some people are on the wait list much longer than others. So the state and federally funded programs that we screen for are the Home and Community-Based Services Medicaid Waiver. That's what a lot of people think they're applying for. They don't really know as much about the other ones that I'll speak a little bit about. So there are income and asset guidelines because this is a Medicaid service. So we'll go over those guidelines a little bit as well. Other programs are community care for the elderly, which is also a phenomenal program. It's administered through our lead agencies, which differ by county, and it offers, excuse me, nearly the same amount of services as you would receive through the Medicaid program. We also have the Alzheimer's Disease Initiative. This is designed for people who are diagnosed with Alzheimer's or other related dementias who have caregivers. And really this program is to help the caregivers. It offers some respite so that they can leave the house and know that their loved one is not alone. They're not going to go wander. There's someone there with them. We have Older Americans Act programs, and those are varied. We have one that is also very similar to community care for the elderly or for the Medicaid waiver, where it offers a very wide spectrum of services in the home, and we'll go over the services that are possible. And then we have home care for the elderly, which is actually a stipend for the caregivers of someone who is they live with and are caring for. Those stipulations for that are that you have to also be below the same income and assets for Medicaid, and you have to live with the person that you're caring for, and it's a stipend of $160 a month just to help with the expenses that arise as being a caregiver. And sometimes that $160 a month can mean everything when you're having to buy Ensure or incontinence supplies. Services available under the programs that we offer, and this list is by no means all-inclusive. I've seen some phenomenal things be done for people in emergency situations, but common ones are the personal care, the homemaking. Home-delivered meals is a program all its own, but then some of the programs will also offer meal preparation. The respite care, caregiver training and support. This is a big one. Being a caregiver can be a very overwhelming job, and we recognize that, and all of these programs recognize that. So we're here to support the caregivers as well as the seniors that they're caring for. Emergency alert response systems. I've fallen and I can't get up. Many of these programs pay for that for the client. Companionship. We have all heard a lot about social isolation in the past year, but for many people, it's not just the past year that social isolation has been a problem. So that's a big benefit of these programs as well. And then the case management, people to make sure that the services you're getting are appropriate, that you're getting enough services, that you're not missing out. So again, the home and community-based Medicaid waiver, the whole purpose of it is for individuals to live in their own home or a home-like setting, like an assisted living facility, rather than an institutional setting, which would be considered like the nursing home, which is a little more restrictive and less home-like. Eligibility for the Medicaid waiver would be 60 years of age or an adult over the age of 18 with a disability. You would need to meet state income and asset guidelines, and you need to meet a nursing home level of care. I will say, if you are not below or at the state income and asset guidelines, that doesn't mean you don't qualify, and I try to make sure everyone who gets an assessment knows that. It simply means that, if you're close but you're over, you're going to want to speak to a Medicaid planner or an elder law attorney to help you become financially qualified. It will not disqualify you. And this very tiny print is the current income and asset guidelines. It changes frequently, so when you call, we can go over the income and asset guidelines with you if you have questions. Right now, it's $23.82 a month in income if you're single, and $4,764 a month if you're married. Asset limits are $2,000 if you're single and $3,000 if you are married. Notice, if you can read that tiny print, it is different than regular community Medicaid. For regular community Medicaid, that's who's going to pay for your doctor's appointments, your prescriptions. It's a much lower level of income, but a much higher level of assets. So just because you qualify for one doesn't necessarily mean you'll qualify for the other. Just something to keep in mind if you find yourself in that situation. What's a level of care? Level of care is determined by whether or not a person would be able or unable to care for themselves for any length of time, and if being on their own without receiving assistance poses a danger to them to where they cannot live safely. If that is the case, then yes, they most likely meet a nursing home level of care. Reasons for having that level of care can be medical, cognitive, behavioral, or functional. So a lot of times we'll ask on the assessment, what is your overall level of health at this time? And it's a multiple choice question, so we'll give them the choices. Someone might have dementia and not be able to remember anything, but they can walk around and, play with the vacuum, and so their caregiver says, well, it's pretty good. And then as we go further through, we realize, okay, we're talking about your overall health. So let's revisit that question because the cognitive is part of that consideration. That is pretty much everything I have on what we do for the Medicaid. At this point, I will turn it over to Camelita Aldridge, who can talk about Medicare, and will be available for questions afterwards if you have any.
Thanks, Jen. Okay, good afternoon, everyone. My name is Camelita Aldridge, and I'm the SHINE Program Manager. And to pair with what Jennifer has discussed, what I'm going to talk about are the areas of Medicare where Medicare does not cover items 100%, and it relates to those folks who are low income. So I'm going to discuss how Medicaid or a federal program known as Extra Help will come alongside folks' Medicare and help with Part D, which is the prescription drug expense, or the Medicare, Medicaid, QMB qualifiers that folks would need help qualifying for their Medicare. So we receive a grant known as MIPA. It's the Medicare Improvement Patient Provider Act. And through this grant, our counselors are able to screen for financial assistance related to Medicare. So someone must qualify for Medicare to be eligible for either of these programs. The two programs, first one is the Medicare Savings Program, aka MSP, or Extra Help, aka LIS, which simply stands for Low Income Subsidy. Let's look at the Medicare Savings Program first. The Medicare Savings Program is designed to come alongside a low income beneficiary for Medicare and help to alleviate some of the cost with that. The test is income and asset related, so if you qualify or meet the qualifiers for income and asset, then you could be eligible for one of four levels of benefits under the MSP. The lowest income level benefit or recipient will receive what's called QMB. Now, our volunteers help with the application process. We don't determine eligibility, but we will help you gather the information necessary to complete the application. Application can be done online, so if you call in to the AAA at 866-413-5337, a referral will be made to one of our Shine counselors who will help with the application. And that's done through DCF. And we help with folks who qualify for Medicare due to age, but they haven't worked or earned enough quarters. So let's say they move to the US and they're here for 5 years, so they have to be here for 5 continuous years. There is no way they can earn 40 quarters in 5 years. So therefore, if they're low income enough, they've paid into the system some. If they qualify for benefits, we could get them screened for Medicare Part B, help with that enrollment, and they would have Part B only until they become eligible for Medicare Part A. So I said earlier that it's an income and asset test, and income is any income that comes in. Income can be earned or unearned. So earned income would be what you're receiving. Some folks work a part-time job beyond age 65, so that would be earned income. Unearned income would then be what you collect through either a pension or Social Security income. And assets would be everything outside of your primary residence or primary car. So for instance, if you own a home and 2 cars, first car wouldn't be counted, home wouldn't be counted, but the second car would be counted as an asset. And basically what we try to do is just get the value of that car, because once the application goes in through the Department of Children and Families, they're going to want to know, and they pull an income and asset screening anyway. You sign a financial release, and they pull from the IRS to Social Security to all these, your banking information, and they basically know what you have in your account because you signed the release. The handouts I gave you has all the current income and asset information. Like Jennifer says, these change periodically. So the one, and they change about once per quarter. So there's a change that's due to come out, and it will say April 2021. So the information will change then. It usually doesn't change a whole lot, but for some people, a $20 difference bars them from eligibility for the program. So if it goes up by 20 bucks, several people will become eligible for the program. Then LIS, this is one that helps folks a lot. And before I go into LIS, there's a program. So if someone meets the income and asset qualifier for the Extra Help or Low Income Subsidy program, but they're just applying and they need medication, there's another program known as Linet, and through that program we can get them emergency coverage for their medications so that they get their medications sooner and not have to wait for Social Security Administration to approve the application and then get the medication. So that's a program that's not listed on here, but it's available to those folks who meet the income and asset criteria for the low income subsidy, also known as Extra Help. So LIS is administered by the Social Security Administration, and it provides assistance for prescription drug coverage only. Here's the kicker, though, for those folks that meet the, let's say you need assistance with your prescription drug and you don't qualify for LIS, but you would qualify for pharmaceutical assistance. We would have to do an application for LIS to say you don't qualify for LIS, and so the pharmaceutical company would then assist with the cost of your medication. And it could be from them providing you an expensive drug for 6 months up to however long as there's funding available for that drug. The LIS reduces someone out-of-pocket cost. And how does this work? I'm going to use an example of a prescription drug for insulin. For instance, low-income folks, their copay is about $200. What LIS does, it comes alongside Part D. If they have a prescription drug that they're paying premium for, it reduces the premium to zero. If there is a deductible, so let's say the deductible is at $445, it reduces the deductible to zero if they have 100% LIS. And then the copayment, so that $200 copayment is now reduced. If it's a brand name, it's reduced to like $9.60. If it's a generic, it's about $3.60. So you can see the significant savings there for the beneficiary. And for someone who has outlived their savings, this become quite important for that person, because then that's $200 that's coming out of their $1,200 check for Social Security. We talked about that there are 4 levels of extra help, and the lowest level is what gives you 100% coverage. Then the highest level basically is a 25% share. So the 25% means that the program pays 25% benefit, and the beneficiary is on the hook for 75%. If you would like to learn more about these programs, at our table, we have a schedule of events, and every month we've been doing virtual events, and we do a financial assistance program or webinar that we go into a lot of details about the low-income subsidy and the Medicare Savings Program. Thank you so much for joining us today. And if you haven't signed in, if you would, that would be very helpful for us. Thank you.